Cyril Ramaphosa is expected to make a decision soon on whether to keep the country at lockdown alert level 1 or impose further restrictions. It comes after the Omicron Covid-19 variant was detected in the country 2 days ago. Talk more about this and other coronavirus-related issues in South Africa. I'm joined now by the National Vice Chairman of the South African Medical Association, Dr. Mvuyisi Mzukwa. Dr. Mzukwa, always good to have you on News at Prime. So, at this stage, what we know is that the cases of this new variant are predominantly in Gauteng, but the likelihood is that it is very well likely to be present in other parts of South Africa already.
Afternoon, Tembekile, and to the viewers. You are quite right. All we know at the moment is that this is concentrated in the Tshwane region in Gauteng. And we know that so far those are mild cases. There is no much of community spread as far as we know.
So the health minister yesterday during the briefing that he gave on the fast-moving story said that one of the other issues that may need to be relooked is around curbing movement between provinces. We've never really done that with previous waves, and there's little scientific evidence to suggest at this stage that it would work, given how fast variants can move even before they're detected, isn't it?
I concur with you, Tembekile. I don't think we need that kind of panic as South Africa. We can't be panicking. That is going to cause other countries to panic. I mean, there is no evidence on the ground to suggest that this is a severe form of COVID. And on top of that, we know that community spread is not that much so far. We don't know what is going to happen in the next week or two. But I don't think we need to adopt knee-jerk reactions when we attend to this. We've got scientists in the country who are respected in the world. We've got technology. We can detect, new variants. But on top of that, we do have public specialists who can assist us analyze, the behavior of this variant on the ground. We don't have that information at the moment. I don't think we should be closing down anything at the moment, including, curbing these travels between provinces. It's unnecessary so far.
What about a stricter level of lockdown? Yes, we're still now recording about 2,000 plus new cases of COVID-19 2 days in a row. We've seen that this week alone. Is it not better to tighten restrictions now rather than wait for an advanced spread?
Those restrictions may be localized. It is possible that we can have localized restrictions in the area of Tshwane or even around Johannesburg. But I don't think we need to go to, a lockdown. I mean, we've been complaining about other countries taking hasty decisions. We can't do that as the country when we don't have evidence. What we need is evidence, and we act on evidence. But I do agree with you, if there's a need, we need to assess the rate of community spread in Pretoria alone and the surrounding areas, including the greater Gauteng. We can't just take, drastic measures out of nothing.
And how much of a concern then, a danger, is our low vaccination rate? Because as things stand, far less than half the population has actually been fully vaccinated.
I think so far we're not that bad, but I mean we know that the group that we're worried about is the group above 60. I don't think we've done much there to have those people vaccinated. We've got a better half of them, but we still have much of them not vaccinated. So that's the group that is currently at risk. Those who are above 40 also with underlying medical conditions. We are worried about those people, but I think we still have to encourage more people to go and vaccinate and assist and even open on weekends to make sure that people are having access to these vaccinations. But I do think that also we need to see the cases that are contracting COVID-19, the current variant. are those people vaccinated or unvaccinated? If vaccinated, what kind of a vaccine is it? Johnson & Johnson or Pfizer? We need to analyze all those things.
And one of the other things you were mentioning is the need at this point to manage the panic, anxiety and uncertainty among people. How should government go about getting that right? You said we don't need to go full out on hasty decisions as far as restrictions, but how do you reassure a population when you're working with such thin information as we are with Omicron?
I think we need to concentrate there in the Swana region. People that have been identified with the variant or those who have tested positive, they need to be educated on how to behave, now that they are diagnosed with this variant. We need to make sure that those people don't cause community spread. We need to make sure that we monitor the behavior of the virus. Currently, we haven't seen much of these severe cases and stuff like that, but it does not mean that we are not going to have severe cases. But on top of that, we have seen younger people getting infected, but that is a cause for concern because those people are living with grandparents and stuff like that. They might infect those. So it is very important that we have a clear message. If you are a clinician attending to a person who's positive, I think you need to spend more time explaining the reason why the person should be isolated at home.
Dr. Mzukwa, always great to speak to you. Thank you, sir. That was the National Vice Chairman of the South African Medical Association, Dr. Mvuyisi Mzukwa.